We will have a full load today. Marami pong mapapag-usapan sapagkat ayon po sa pinakahuling balita ay halos 1 milyon na ang mga survivor sa COVID-19. It's nice to know that most of those reported with positive cases have recovered. And one of our guests today recovered from COVID-19. But one of the reasons why we will be discussing this issue today is the fact that there are families who are at a loss on how to attend to COVID-19 survivors. How would the community treat people who recovered from COVID-19? In the first place, pag sinabi bang nakalabas na ng ospital ang isang pasyente, ay ligtas na siya. Merong mga pagkakataon na ang tingin ng komunidad sa isang nakaligtas ay parang leproso. Masakit aminin pero siguro ito'y dahilan sa kakulangan ng kaalaman kung ano ba ang detalyes nito. But today we're joined by General Restituto Padilla, tagapagsalita po naman ng National Action Plan versus COVID-19. We hope former Secretary and Chair Cora Alma de Leon will also be joining us, coming from a social worker's perspective. We also have with us si Rick Casco, isang kaibigan natin who survived COVID-19. We hope Dr. Nick Chavez, a psychiatrist, would also sit with us today. We have the president of the Philippine Nurses Association, si Ginoong Melbert Reyes, to share what it is para sa mga nurses attending to COVID-19 patients. We're happy Dr. J.V.R. Gutierrez, an internal medicine specialist whose subspecialty is pulmonology from the Metropolitan Medical Center, and a member of the board of the Filipino-Chinese Medical Society is also with us today. And of course, a good friend, Dr. Tan Cho Xiong, an expert in neurology and psychiatry with the Chinese General Hospital and Medical Center and Metropolitan Medical Center. So, siguro simulan natin kay General Resty Padilla. Ano po ang paningin ng National Action Plan Task Force versus COVID-19 sa kalagayan ng mga nakarecover na mga pasyente? Good morning and welcome to the discussions, General Padilla.
Good morning, Melo. On behalf of Secretary Galvez and the whole National Task Force Against COVID, yung team po nila Secretary Ronsana at saka DILG Secretary Anyo. At kay Secretary Galvez na kung na aking nire-representante ngayong umagang ito. So salamat po buhat sa kanila. Naghihingi lang ng paumanhin si Secretary Galvez because he cannot join you personally today as a result of prior commitments that he has to attend to this morning. So may I just begin that last year, it was from Secretary Galvez personally where we heard first of the serious concern for the stigma brought about by COVID-19. If you will remember po, as we entered into the strictest lockdown last year, and towards the middle of that, we reported, and Secretary Galvez personally mentioned, that we need to approach the problem and the stigma posed by COVID-19 from a very holistic and a whole of nation and a whole of society approach because of the sudden rise of suicide cases. Ang dami hong tinatamaan ng sakit, and then when they get back to their provinces, they would not be welcomed even by their own families because of the stigma brought about by COVID-19. At tama po ang sabi ni Sir Melo na they treated it like leprosy. So they abhorred coming close to people who were infected. And that's why there was also a call for the church to participate and for the whole of society to pitch in their efforts to help and assist in alleviating the mental anxiety of the victims of COVID-19. So fast forward to where we are now. Secretary Galvez laid out a holistic plan for the Philippines as we move forward in treating COVID-19. And in the update that he provided last April 29, during the national vaccination update, the last item he showed during that presentation was a 3-year plan to prepare for the long haul. So COVID-19 won't immediately disappear. We will have to face this situation for a bit of time until we are fully recovered and everyone has been inoculated and we are able to achieve herd immunity so that we can come back to a new normal as we talk about the new normal setup. So we cannot go back to the prior COVID-19 situation anymore. It will have to be a new normal. That's what we have been saying. And among the steps that he said was this year, we will be embarking on a containment strategy. And then in the year that will follow, 2022, we will have to eliminate the threat of COVID-19 and then self-sufficiency in health system or healthcare in 2023. So in the first step, that is what we're doing right now in 2021. We're trying to enable and strengthen the prevent, detect, isolate, treat, and reintegrate strategy, or what we call the PDICR. This is so that we can build resilience, identify the hidden enemy lurking among us, isolate them so that no one else will be infected, and start treating those who will need care. And as we have seen in the last few months that when we started 2021, we were hit by a tsunami, quote unquote, no, of a situation. We got into a complex emergency because of the entry of the new variant, which made COVID-19 much more infectious and to a certain degree, in some cases, even deadlier. That is why the number of people who got infected increased in numbers that have gone beyond those that were the highest numbers even of last year. And then the number of deaths started increasing as well. But thanks to the cooperation and the assistance of all and of every Filipino, I would say, in every corner of our society, pitching in their own part by following the health protocols and then following the lockdown again, we were able to stem the tide of an increasing number of COVID-19. But the battle is far from over. It is still continuing. Now, madami doon ho sa gumagaling. Tama po yung sabi nyo, narinig last week, are families who got infected. And the stigma remains because even in their own neighborhood, even in their own families, after they get sick, they tend to be treated like people who have been infected with leprosy, as we have been saying. But as we have gone through last year, we started to know more about the disease. Madami na ho tayong natutunan. So science was able to contribute, the medical profession was able to contribute, and we got to know COVID-19. So hence, we're trying to live with it right now. So living with it is employing the strategy that was discussed by our health professionals and our economic team, which is dancing and fighting the virus at the same time. So yun ho ang ginagawa natin para magkaroon ng delicate balancing act between the economy and public health care. But there is a demand and there is a need to support those families and those who got sick. This is why in the strategy that was proposed by Secretary Galvez, part of that was the aftercare, social healing, as he mentioned it, from the stigma of COVID-19 until we can get into a full recovery. Because we will need everybody's hand. We will have to help each other. Everyone, whether they did not get sick or they got sick, will have to contribute their own contribution to get our country back on its feet. And that is why we need to understand further the predicament of all of these families. So they must not be treated by people like people with leprosy, but treated with more compassionate care, treated with more compassion, treated with more understanding, and at the same time, welcome back. That's why we have a reintegration strategy. So, ang punot dulo po niyan ay siguro yung pagpapalaganap ng pagkaintindi dun sa sakit. Because the more we understand COVID-19, the more we will be able to understand those who got sick, that they don't become infectious anymore after the 14-day or so treatment. And they will not be able to pass it. So that's why we don't need to abhor them. We need to reintegrate them. We need to live with them, and we need to help them. So on that note, sir, I will pass back the mic to you. And I hope that the context of this discussion this morning coming from that perspective offered by Secretary Galvez last April 29 will help in facilitating and enlivening this discussion.
Yeah, the reason I had this topic today, meron kaming mga karanasan tungkol sa COVID. My son recovered from COVID-19 after spending 12 days in the hospital, 9 days of which were spent at the ICU. And he's back, he's working, and everything is just fine. Pero meron ako na-refer na mag-asawa sa one hospital command center, and they were referred to a hospital they were attended to. Kaya lang on the first night at the hospital, dun sa ward, may namatay dahilan sa COVID. So, it was traumatic for the couple to be there. No? Nakakita yung naghihingalo, namatay, and it took some time bago na alis yung labi doon sa silid. Nung maka-recover ang mister na iwan yung may bahay sa ospital, may tumalon naman mula sa second floor noong gusali. Na-revive, binalik ulit doon sa kwarto. Traumatic na naman para sa pasyente. But anyway, let's hear from a good friend, Rick Casco. Rick, you recovered, we're happy you recovered from COVID-19. Ano ba ang iyong karanasan? Please.
Oh yes, thank you Melo, and good morning sa nakikinig at sa lahat na ating mga resource speakers. No? Siguro una sa lahat, follow up ko yung sharing ni General kanina tungkol sa stigma. No? Dahil yung stigma, isa yan sa naranasan ko no? Pagkabalik sa bahay, no? Sa community. No? Not any one of my even best friends, close neighbors, no, and relatives have come to give me aftercare, no, yung pagkatapos ko ma-hospital. I just had one brave soul na best friend ko na accompanied me, no, and a professionally hired caregiver, no. Sa aking pananaw, yung stigma, katulad nga na ng mention, ano, nag-emanate yan sa dahilang ang sakit ay bago, no? Parang katulad din yan ng HIV/AIDS, no? Na nung araw pag may HIV/AIDS ka parang ang dumi-duming lumapit sa iyo na hindi kasi naiintindihan kung paano yung sakit, no? Ano yung nature ng sakit. Ngayon, importante siguro malalaman ng mga tao, no, the general public, kung yung bang COVID survivor nagkaroon na ng immunity, hindi na ba siya nakakahawa, no? Dahil yon parang hindi malinaw, no? Nung ako lumabas sa ospital, ang sinabi meron na akong immunity, pero ibang doktor ang mga estimate, sabi 3 months to 8 years, no? Pagka ganun yung range ng estimate mo, parang yung level of confidence mo dun sa kanilang statement sa yung immunity at hindi ka na nakakahawa ay medyo malabo, no? Kaya siguro doon dapat mag-information campaign, no, ma-educate yung public, no, na ano ba yung katayuan ng isang COVID survivor, no? Of course, siguro I'm blessed na hindi ako nag-suffer ng mga psychosocial stresses, no? Pero nare-recall ko yung mga pinagdaanan ko, no? At I have come into a lingering illness, no? Dahil sa nung panahon na yon, na 1 year ago, that I was one of the first 5,000 or so cases in our country. Very aggressive yung experimental treatment, no, na in-administer sa akin ng RITM, no, dahil wala pa tayong base sa mga sakit na yon, ano, na institute sa yung mga antiviral, antibacterial, anti-inflammatory, steroids, anti-blood clotting, at kung ano-ano pa, no. And having spent 33 days in the hospitals and 28 days of which in the ICU, yung mga veins ko nag-collapse at saka yung mga blood vessel ko, yung swero ko, at a time sa paa din siya nilagay, no? After that, ang kakulangan ng sistema, no? Although hindi ako naninisi at naiintindihan ko kasi yung sitwasyon, no? Nung uwi na ako sa bahay, tinanong ko ang ospital, wala ba akong post-hospitalization check-up, no? Kasi nung mga previous times na na-hospital ako sa ibang sakit, after 2 weeks, you have to go back to a doctor and so monitor niya ang progress of recovery mo. Parang walang ganon, ano? Ang sabi sa akin ng hospital, if you have some concern or worry, try to contact your community doctor or your personal doctor. And which I did, no? Kasi nung panahon na yon, siguro sinasabi ko na hindi talaga siguro kaya kasi nakita ko mismo sa ospital how stressed, no, yung doctors at yung mga nurses natin, ano. Pero syempre ideally as we go on, no, siguro tanong natin, no, sa plano, sa approach, no, how could a survivor after a while, no, be subjected to monitoring, no, and as you do this, no, because we need to study the disease very well and very closely. Siguro dapat maging database yung nako-collect ng proseso kapag nagkakaroon ng post-hospitalization check-ups, no? Specifically, after more than a year, no, I have suffered vascular disorder, no, for my lower extremities at saka sa aking mga arms, no, which affect blood flow and which make my hypertension unstable, no? So right now ang medication ko is on hypertension maintenance, no? And I need to see a doctor to see more closely ano ang specific cure or approach sa mga blood vessel ko sa paa, sa ankles, sa legs and thighs, no? Which caused me periodic edema, no? At meron siyang discomfort, no? Although hindi naman masakit, pero minsan may heaviness and discomfort, no? So bakit naaantala yung aking pagpapa-check up? Dahil sa insecurity ko, no, na pumunta sa ospital dahil sa COVID cases, no? So yung pa yung isa, kailangan siguro magkaroon ng picture yung ating mga publics, no? Na ano ba ang status ng safety protocol sa ospital, safe ba magpa-check up kung iba ang sakit mo, dahil alam din naman natin na maraming namamatay. Sabi nga, mas marami pang namamatay na non-COVID cases dahil sa naaantala yung pagpapa-check up, no?
Mhm.
So
Okay.
siguro Elo, yun muna ang mga i-highlight ko ngayon sa usapan natin.
Thank you. Thank you. Maraming salamat, Rick. You know, it takes a lot of courage to tell everyone of what you underwent, no? But you know, we can learn from it. Pero I'd like to hear from Dr. J.B. Gutierrez, whose expertise is on internal medicine, and at the same time, pulmonology yung kanyang subspecialty. Ano po ba ang protocol? Ano ba yung SOP para sa isang COVID-19 case?
Protocol upon follow-up.
Paano siya?
discharge.
Di, nasa ospital siya,
Yeah.
paglabas niya, paano ngayon?
Yes. Upon discharge, so we advise a COVID-confirmed patient once discharged, we advise them to follow up, after 14 days. You should have a 14 days quarantine dapat muna. Yun ang advice namin. And to continue wear their masks kasi alam mo, these patients are very vulnerable to any disease. Pwede siyang mahawa anytime with flu or any disease, no? Per se, mga lung problems, mga lung diseases. And practice cough etiquette, maintain pa rin ang physical distancing at home. And if sa bahay sila na-experience respiratory symptoms like cough, colds, fever, within that quarantine period, they should have a check-up. Kasi sometimes when they are discharged, they usually get this hospital-acquired pneumonia, no? Nagka-pneumonia sila eh. Mga 7 days after discharge, magka-cough colds, and we expect na maybe these patients are having hospital-acquired pneumonia. They should have a checkup. And pa-check natin yung blood and the x-rays. And let's see, pa-culture yung blood if nag-hospital-acquired pneumonia, and we give antibiotics, no, for that kind of disease. So basically, we advise the patient 14 days quarantine, please yung social distancing at home, wear mask, cough etiquette.
Yeah.
Okay? Especially for patients na may end-stage renal disease, mayroong diabetes and advanced age. These are the immunocompromised individuals na anytime mahahawa sila ng any lung disease, lung problems.
Yeah. Pero when do you subject a person to intubation? When do you subject a person to hemoperfusion?
Yeah. Hemoperfusion, intubation first na if the patient is having from severe COVID, nagkaroon sila ng desaturation continuous despite the high flow. Yung isasabing high flow nasal oxygen is a machine providing 100% oxygen through nasal air, through nasal port, not nasal ang kanyang entry. Pero if this does not work, then we recommend intubation to provide adequate oxygenation. And syempre, these patients are considered critical. No? For patients naman na hemoperfusion is also a topic na dinidiscuss pa rin. If we introduce hemoperfusion in cases wherein the patients are having desaturation continuously from high flow nasal oxygen, nagde-desaturate, now we recommend hemoperfusion. Okay? So hemoperfusion is a process wherein we get the blood, literally kinukuha yung blood, then pupunta sa dialysis machine, then ibabalik ulit. This filters the cytokines produced by the body, triggered by the bacteria, triggered by the virus. So hemoperfusion, some institutions ginagawa, some institutions does not do this hemoperfusion.
Mm-hmm. Is it an aggressive approach to treating COVID-19 patients?
Yeah, it's an aggressive approach because we want all the cytokines to filter out. I-filter mo siya eh. I-filter out mo siya through the dialysis filter. Mm-hmm. Aggressive yan. Also intubation is also an aggressive approach.
Really? How true is it that doctors usually inform the next of kin rather than the patient of the procedures out to be performed on the patient?
Sometimes, sa pasyente pa rin yun eh. Sometimes we assess the patient. If the patient is too depressed, we assess. Kung if the patient is too depressed and we tell them, sabihin namin sa kanya ng situation, they get more depressed, they don't eat, and it will not help the patient. So kasi Pilipino ganyan eh. Pilipino masyadong some of my patients sabihin nila, wag mo na sabihin sa pasyente kasi baka ma-depress o baka hindi kumain. So coming from the relatives, sabihin ko na sa relatives lahat ang situation, the condition of the patient. Kasi may mental factor pa rin once you open this situation to our patients.
I see. Rick, in your experience, were you told of the procedures that they will perform sa iyo?
Kasi when the first thing I ask is how are you going to treat me, ang sagot talaga, to be honest, experimental, So as I observed, lahat ginawa nila, minomonitor nila ako every day, and they take my blood like twice a day, Ang hindi ko lang nalaman, dahil my family is in America, and they get in touch with my family every day, and that's very good, na sinabi nila that I have come to a point in the boundary line that I may be intubated, and I didn't know that, I didn't know that, and they were readying my family to sign a waiver if this will be done, and ako lang nung time na yun, if I remember, pagpasok ko sa ospital, saglit lang ako nilagnat na wala na lagnat ko. Ang blood pressure ko never tumaas, and I am always awake in the right time of the day, I always ask what medicines are being given to me or injected to me. But what I suffered so much is that nasal oxygen, no? Dahil I just felt that it was drying my mouth, my throat. I couldn't even swallow my saliva, no? When they give me medicine, I cry, no, for pain. And I asked the nurse and the doctor give me a paper and a pen through body language, hand language, and then I wrote them, can you please soften the oxygen? It's killing me. Sabi ko gano'n. It's the one that disabled me to eat, to drink, and I struggle with medicines. No, it weakened me. No, so that is my experience. I don't know whether I am clinically correct or wrong, but that is the feeling of the patient. No, and so when I went home, I recovered, and we were exchanging stories with my family in America, and they revealed that I had come to the point. The doctor said that I was going to be intubated. No, but of course I am seeing my oximeter, no, my oxygen, no, it was 92, it wasn't 95, but it wasn't very low, no. So I just thought that did I really need to be intubated, no? So when I reflect back, I could imagine na siguro kung yung patient hindi niya alam, tapos hindi tinatanong yung pakiramdam niya, baka kaya maraming namamatay sa nai-intubate kasi nasa-shock yung system, no? Kasi ako dun sa nose pa lang, nasa-shock na yung system ko. So yun yung gusto kong malaman.
Okay. Yeah, Doc JV?
Yeah. Oh, yung karanasan ni Mr. Cosco regarding high flow nasal oxygen. We start this. First muna siguro nalagyan sa non-rebreathing mask. Then after non-rebreathing mask, they started the HFNO, the high flow nasal oxygen. Kasi ang aming baseline for the auto saturation is 93 to 94%. So why 90 to 94%? They found out, no, mga studies sa England and sa China, if you fall below 93%, the mortality rate increases around 18%. Now, pag nag-below 92% ng oxygen, 28% dies, no, out of the population na study nila. So we start the we follow the 94% oxygen saturation. So it falls below 92%. Nowadays, no, recent study shows we maintain the auto saturation at 92 to 94%. No. When we say pala oxygen saturation, it is the amount of oxygen nasa bloodstream mo. It's the amount of it is the amount of oxygen that the body requires, no, for body to function properly. Yan ang sinasabi, oxygen saturation. Okay, so parang di tayo nalilito. So auto saturation 94% dapat at room air. So with a device of high flow nasal oxygen, we maintain a saturation of 92 to 96%. So malakas talagang flow 'yon. Parang ang sabi nila parang ilabas mo yung ulo mo sa kotse at ang kotse umaandar ng 100 kilometers per hour. Ganun kalakas yung buga ng hangin. Ganun kalakas yung buga ng hangin sa ilong. Then also side effects of this, no, mga effect ng high flow is magda-dry yung nostrils, magbe-burst sometimes yung mga blood vessel dun sa nostrils mo, sa nasal passages, sometimes nagda-dry ang throat. So we instruct the respiratory therapist to maintain a moisture air. Now, meron siyang humidifier sa side, it should be working properly para hindi mag-dry yung nostrils. Okay? Then we explain to the patient, no, if it falls below 92%, then we have to intubate. Kasi hindi na adequate yung auto saturation, and you might go into shock, no? Might go into hypotension, heart may fail, the kidney may fail because of below 92% oxygen saturation.
Okay. Doc, let me ask you, lumabas ang pasyente, nakauwi sa bahay.
Yes.
Ano yung aftercare programs? Dahil ang sabi ng aking anak, paglabas niya sa ospital, checklist yung naibigay. Ito yung do's and
Ah,
don'ts. Ano ba dapat yung approach? Aftercare talaga. Paano?
Aftercare, just like what I've said earlier, 14 days quarantine, sleep, adequate sleep, adequate diet, proper nutrition, okay? Avoid people kasi people may sa kanila minsan simpleng cough lang but they're carrying influenza virus. Mahawa ka eh. Kaya dapat naka-quarantine ka for 14 days. Aftercare pa rin. Same ang aftercare sa lahat ng hospitals. 14 days quarantine. It is published sa Philippine Society of Microbiology and Infectious Disease na guidelines. Aftercare, 14 days quarantine, cough etiquette, proper wearing face mask, social distancing, adequate
Yeah.
nutrition, adequate sleep.
Yeah. Some time ago, at the Malacanang press conference, I asked the question about aftercare kay Secretary Roque. Nabanggit ni Dr. John Wong na merong long haul na COVID-19. Merong mga tao na gumaling pero 3 to 6 months may symptoms pa at hindi malaman kung anong dahilan, anong nagtitrigger, anong pwedeng gawin.
Yeah. Regarding the symptoms, patients with severe COVID, pag nakita mo ang CT scan nila, magulo. As in, literally full of fibrosis. This fibrosis dun sa loob ng lungs nila, this will cause yung frequent coughing, may shortness of breath. No? So we advise them to mag-pulmonary rehab sila. Meaning, they use this incentive spirometer. Si Mr. Casco ba napagamit ng incentive spirometer upon discharge?
What is that? Is that the one that you blow yung may balls?
Yeah. Incentive spirometer.
I have that, no?
Oo.
Dun sa aftercare sa akin, lahat ng sinabi mo, Doc, meron yan, no? May mga may checklist ako at saka sinabihan ako na kasi I live alone, no? Ang sinabi sa akin, you cannot go back at home alone, no? You have to have a professional caregiver. So I hired one kasi I couldn't walk, no? Ma-hospital ka ng pagkatagal-tagal, meron ka talagang disability to walk, no? So I was in a wheelchair for 2 days. I was in a walker for 3 days before I could walk on my own, no? So that's one, no? Tapos yung mga subsequent x-ray ko, the scar of the lungs, as is almost always pag nanonomonia ka, hindi siya mawawala. Yung sinasabi mong fibrosis, merong mga ganong indicator, but I never cough again, no? Shortness of breath, I'm okay kasi I also exercise, no? I am a gym person. So siguro yun din yung ma-share ko sa mga post-COVID, no? Na gradual exercise as you build, kailangan yun no? Kasi ipina-practice mo yung lungs mo, yung capacity to really expand. No? And then I sing a lot, no?
Good.
So
Good yan, good.
Good. That's nice. All right. We're also joined by Dr. Nick Chavez. Siya ay nasa Muntinlupa Community-Based Mental Health and Wellness Program. Dr. Nick, magandang umaga sa iyo at how are things going in Muntinlupa? Paki-unmute lang po. Yes, please. Okay.
Good morning, Melo. Good morning sa mga kasamahan kong resource speaker, Dr. Gutierrez, Sir Padilla, and Sir Rick Casco. Right now, Mr. Melo, I've been assigned for the past 2 months, assigned ako sa isolation facility na mga capacity of 130 to 150. Now, tamang-tama yung topic ninyong aftercare because we've been drawing this kind of strategies, no? Kasi kung titingnan natin sa psychological point of view, marami na pong pinpoint out si Mr. Casco kanina at si Dr. Gutierrez about stigma, discrimination, being depressed when knowing the situation, kaya kamag-anak palagi ang kinakausap, no? So from the point of view ng sa psychological aspect, pwede kong hatiin yung tatlo. Yung una, yung mga hindi pa na COVID, meron silang set of fears and anxieties and all these things. Kaya meron din tayong set of mga protocols. Yun naman mga actual talagang na nagkaroon ng COVID, kagaya ni Sir Casco. No? Meron din silang set na actual nilang naranasan. And then they undergo this kind of anxiety, depression, and all these mental health issues. No? And then they come up with, halimbawa, katulad ni Sir Casco na gumaling na sila. No? To me, there's some sense of, kumbaga, veteran camp. Kagaya ng mga tinatawag nilang COVID survivors na tinatawag nilang page. You know? They're so proud about them being survivor. Tapos they were very eager to share with these other people na kaya natin, etc. and all these things, and sharing these health practices. At kagaya na sinabi ni Dr. Gutierrez, pagkatapos po magkaroon ng nag-survive ka for whatever, kung asymptomatic ka ba, survivor pa rin yan. Mild symptoms, survivor ka pa rin. Moderate to severe, survivor ka pa rin. Lalo na kung critical, kung naka-intubate, survivor pa rin ang labas natin doon. Aftercare pa ng pinag-usapan. Yeah. So ang ating gawin natin, sa akin as far as the psychological aspect is concerned, wala pa rin substitute sa sinasabi ni Dr. Gutierrez na healthy lifestyle. Even before, during, and even after. Kaya lang, ang napansin ko ngayon, kumpara sa unang buwan natin at kumpara sa present moment, medyo lamang na tayo because of a lot of informations. Mas klaro na rin ngayon ang ating tinatawag nating protocol sa treatment. Dating sinasabi ni Mr. Casco na these are all experimentals, etc. Nakakatakot din yun pakinggan pag lalo kung pasyente ka. Pero ngayon, meron ng mga protocol, 1, 2, 3, 4, mga menu or yung tinatawag naming cocktail. The severe. Ito'y nag-a-add ng assurance and lessening the anxiety. Tapos ito pong mga tinatawag nating mga DIY, do-it-yourself treatment. Yung tinatawag na vitamin C, calcium, may mga linhwa, etc. na kayang gawin sa bahay. Nakakadagdag din po, Melo, ng tinatawag ng if only, sabihin nila natin psychological, pero I don't believe that it's purely psychological. It is a real thing na pag sinabi mong sinunod mo itong hydration, good rest, tulog, pagkain na maayos, regular exercise, meron kang vitamin C with zinc, meron kang etc. It will somehow increase our level of yung peace of mind. And then, ang pinaka-epekto nito, Melo, hindi lang siya for psychological because we know for the fact that ang tinatawag nating strengthening our immunity is not only about the food, it's not only about the rest, it's all about the peace of mind. Pag ang tao depressed, anxious, bagsak ang kaniyang immune system. Tataas ang kanilang tinatawag na stress hormone na tinatawag cortisol. Pag tumaas ang cortisol, lalo na sa mga chronic anxious patient, depressed, be it caused by COVID or na-trigger ng COVID, tataas ang kanilang cortisol level. So what is the cortisol level? It's our stress hormone. Pag tumaas ang cortisol level, taasan na lahat ang numero. Ano po yung mga numero natin? Blood pressure, pulse rate, cholesterol, diabetes, etc. Lahat yun mga magtataasan sila. Okay. Or lesser ang control nila. So ako pa rin, from their point of view, ng psychological aspect, is still the healthy lifestyle. A combination of yung ating rest, food, balanced diet, regular exercise, and avoidance of, for once and for all, tigil muna natin yung bisyo na nagpapatulong din, lalo na sigarilyo, saka tinatawag na inom na damagan. Nagdudulot din ng lesser immunity. Thank you.
Pero you will agree with me, Doc Chavez, kay Dr. Gutierrez din, kay General Padilla, na isang problema ng isang nauospital yung gastos. Maaaring makaligtas ka sa COVID, pero pag nakita mo na yung babayaran mo, baka doon ka matuluyan. Di ba? Doc, how do you deal with that? Ako no, pag na-hospital ako, parang pinipintahan ko yung bill eh. Dahil baka masyak ako eh, mahilo ako eh. So how do we deal with that? Is there a way we could deal with it? Dr. Gutierrez, General Padilla.
Sige ho, ako muna.
Sige po, General.
Well, the resources of government are not infinite, no?
Of course.
But the health system and the healthcare mechanism that we have in the country allows for a chunk of the support na mapunta sa mga nagiging pasyente at biktima. So although ang ating hinahangad ay free ang healthcare natin, hindi pa po natin kinakaya yan. Pero sinisikap po natin gawin. Kaya ang PhilHealth ay patuloy na nakikipag-ugnayan at ng mga ospital, both public and private, na mabilis maibigay yung mga bayad sa kanila na parte ng PhilHealth reimbursement. So, kung ito ay mapapabilis, yung tulong po na yon na napupunta sa mga pasyente, mapapabilis din at mababawasan din ng kaunti. Hindi naman mawawala totally, pero mababawasan din. Kasi malaki rin ho yung suporta na binibigay ng COVID support ng PhilHealth. Halos kung hindi ako nagkakamali ho, mga 700,000 kung aking narinig ng tama. Pero nung simula po yung COVID last year, sinagot po lahat ng gobyerno, lahat ng gastos. Kaya hindi ko naman sinasabing maswerte yung unang nagkasakit kasi sinalo ng gobyerno, pero yun po yung naging suporta. But as the pandemic continued, and as I mentioned, hindi ho infinite ang resources ng government, we had to scale down the support to a level that can allow us to continue. To continue para hindi mo ma-deplete yung sources ng PhilHealth at maituloy niya yung pagtulong sa lahat ng mga Pilipino na nagkakasakit. So that's what's happening now. So we will try to continue with that and hopefully employment returns, because with the return and increase of employment, the contributions to the PhilHealth system becomes larger. Pero kung nawawala po ang trabaho at nasisira ho ang ekonomiya, lalo po nadideplete yung kaban ng PhilHealth na makatulong sa iba. So this is why yung sinasabi ho natin sa National Task Force na Delicate Balancing Act ay napaka-importante, because the economy needs to flourish in order to support a very robust healthcare system. So without an economy that is progressive and going up at naging sluggish ito, magiging sluggish din yung pasok ng pondo dun sa ating healthcare system fund. So kaya nga itong Delicate Balancing Act ay kinakailangan maintindihan ng karamihan sa ating mga kababayan na napaka-importante po at hindi dapat sinasantabi. Kaya kung ako ang tinatanong, paulit-ulit ko sinasabi na ang sikreto po sa pagtagumpay sa ating COVID-19 na karanasan ngayon ay nakasalalay sa bawat isa sa atin.
Okay.
Yung ambag natin. Yun po yung aking punot dulo doon. Kasi kung hindi tayo magtutulungan, yung whole of society, whole of nation, whole of everything approach ay hindi ho magiging makahulugan.
General, yung bang malasakit center napapakinabangan pa o malas at sakit na lang ang tumatama?
Sana naman ho ay marami pa rin pakinabang yung mga taong bayad na pumupunta dyan. So nai-relink naman po siguro sila sa dapat pagpuntahan ng kanilang mga hinanaing.
Opo, mabuti po kung ganoon. Pero isa sa mga nasa frontline ay yung mga nurses. Mr. Melbert Reyes, you're the president of the Philippine Nurses Association. Ano ang pakiramdam ng mga nurses na dumadalo doon sa mga may COVID? Hindi ba sila naninervyos? Nagkaka-COVID rin ba sila? Anong posisyon ng PNA?
Ngayon po, no, so especially dun sa recent surge, karamihan po sa ating health workers at mga nurses ang nag-positive din with COVID-19 despite po the vaccine, despite the vaccine. No, hindi po mawawala yung takot, no, with our health workers, sa mga nurses, na baka mahawa sila. No, but then kasama po yan sa sinumpaan na tungkulin ng ating mga nurses, no, to take care of our fellow Filipino na nagkakasakit, regardless po kung contagious yan, nakakahawa o hindi. Now, with we make sure lang po at hinihiling din namin sa mga healthcare system na priority yung ating protection sa mga nurses. Ano po?
Okay. Would you have facts and figures about nurses who got COVID and who recovered and those who died, and how were they attended to by government and their families?
Recently, yung sa current surge po, mga 10 po yata yung mortality namin, 10 to 11 yung mortality. And we are getting a complete data na with the different regions. But yung pong pumasok na mga data sa amin, mga 2-3 regions pa lang po yun, mga 1,000 plus na po yung nag-positive na nurses natin across those 3 regions. Wala pa po ang NCR plus bubble doon because we are asking data from the Department of Health din. So ganun po kadami yung nagpa-positive natin na healthcare workers. Ano po, pagka po asymptomatic ang nurses natin, nilalagay po sila sa isolation, no? So sa mga quarantine facility, they like other patients, ano po, yan na naka-quarantine sila, and then they have to finish their quarantine. Then after po noon at natapos na nila yung kanilang requirements of quarantine, they will go back to hospital and serve again. Ano po, so ganun po yung buhay ng ating mga nurses.
Melbert, hindi kaya nagkakaroon ng pagkakataon na yung mga ospital, yung mga health facilities, nagkukulang ng mga tauhan dahilan sa pagkakaroon ng quarantine ng mga nurse natin?
Yan po ang pinakamalaking problem natin, ano po, kasi bago pa po mag-pandemic, bago pa po magkaroon ng COVID-19, marami na po ang kulang. Marami po tayong manpower, kakulangan sa manpower ng mga hospital. So lalo po yan lumaki, yung problema na yan, nung nagkaroon ng pandemic. At specifically kapag po nagkakaroon ng surge, kasi kapag po nagpa-positive ang ating mga nurses, ang ating mga other health workers, they have to go on quarantine, po. So pagka naka-quarantine sila, wala pong naiiwan, may maiwan man, kakaunti, and they have to cope, yung institution have to cope with the loss doon sa manpower. Po, so kaya po nananawagan niya ang ating healthcare system, na sana ay ma-augment natin yung kakulangan sa manpower, specifically sa ating mga nurses, po, kasi 24 hours sila yung kasama ng ating COVID patient.
Okay, Melbert, interesado akong malaman, ano ba ang kondisyon ngayon ng nurses natin? Sila ba ay interesado pa rin mag-abroad? Ano kaya?
Hindi po mawawala yun, po, Camelo. Hindi po yun mawawala. It's because our nurses, our Filipino nurses are demoralized, dissatisfied, po, and they felt like they are not valued here in our country. Yun po yung katotohanan, po. We cannot parang hindi naman natin sila mapipigilan because it's their right to look for a better opportunities. Kahit po anong sabihin natin, maglingkod sa bayan muna, but then yung bayan kasi hindi binibigay yung kailangan nila. Po, ang hirap po na sabihin natin na ang ating mga nurses ay kailangan ngayon, kailangan nilang maging bayani para sa ating mga fellow Filipino. Pero paano po yung buhay nila? Paano po yung mga binubuhay nila kung hindi naman kaya ng ating government na ibigay yung kailangan nila? No, we have been deprived of our rights, to salary and compensation for the longest time. Po, yung aming Republic Act ay 2002 pa, pero hindi pa po nai-implement fully, ngayon lang nung pinanigan ng Supreme Court yung salary grade 15. And yet, nagkaroon pa rin ng problema with the demotion. Nakakalungkot po yan kasi during the pandemic, ang ating mga nurses ay pinipilit pumirma ng another classification nung kanilang position. Nurse 2 sila for 20 years, 30 years, tapos ngayon papipirmahin ng LGU, because we are devolved ng nurse 1. Sabi nila, wala naman daw demotion, it's because hindi naman nagagalaw yung salary. Pero yung bang tingin mo sa sarili mo, yung self-esteem mo, na ang tagal-tagal mong in-achieve yung iyong higher position, promotion, ibabalik ka sa square one. Nakakalungkot po yan na during this pandemic, ngayon pa nararanasan ng ating mga nurses yung mga ganyang problema. Yung ating allowances, yung mga hazard pay, hindi pa rin po naiibibigay sa ibang parte ng Pilipinas. So nakalulungkot po yan, Sir Melo.
We also invited the Department of Health, but anyway, General Padilla comes from the National Task Force. So General Padilla, pwede na ba ipangutang ng nurses yung mga dapat bayaran ng gobyerno hindi pa na ibibigay? Pwede na ba idaan sa 5-6 yan? Masakit aminin, pero nangyayari yan, di ba?
Yes. Melo, ang karanasan ng ating mga nurses, I really am on the side of the nurses in establishing more importance in the services they provide. Kasi sa mga ganitong panahon, parang mo silang sundalo. Pumapasok ko sila sa alanganin at pinagpapatuloy po nila yung laban sa isang kalabang hindi natin nakikita at sila yung nasa frontline. Tunay yan na sakripisyo talaga yan. At yung pangangamba na pagdating nila sa pamilya nila ay dala-dala pa din yung sakit ay nagdadagdag pa doon sa stresses na kanilang hinaharap. So, I am for the compensation of nurses in a fitting manner. But of course, as I said, it has to come hand in hand with how the economy will have to grow. We have to grow the economy first to increase our GDP in order to afford it. And I hope it can happen soon. Sana naman ho, mangyari ho yan. Tapos yung sa issue po ng paglabas ng bansa ng mga nurses, may mga kilala rin ho ako na nag-deploy. Totoo po yan. Very valued ang ating nurses sa buong mundo. At hinahanap po sila. They are really sought after. And this is something that we can be proud of because the amount or the care that we provide our patients as Filipino nurses is unparalleled by others. So, iba ho daw kasi yung kalinga ng Pilipino pagdating sa pag-aalaga ng mga pasyente. Kaya sila lagi ang hinahanap. Kaya I'm proud of that, but at the same time, nurses as much as they can in other countries. But I guess the answer I see is in the economy. We have to grow our economy in order to increase the coffers of government and afford that amount. So, but we are for the nurses. We are doing a good job.
Okay. All right. At least merong ikang pagtutuon ng pansin ang pamahalaan sa nurses. Siguro not only nurses, we can also focus on medical technologists, midwives, and other frontline workers in the hospitals. No? We saw how they work. And we can
Tama.
No?
Tama, Nelo, no? Kaya nga nung nagsimula tayong sa programang ito, 'di ba binanggit ko yung holistic plan na mungkahi ni Secretary Galvez. At yun nga po yun yung pagpapalakas ng ating healthcare system at pagbibigay ng importansya dun sa mga kinakailangan gawin. So kasama na diyan yung pag-establish pa ng isang vaccine manufacturing capability ng ating bansa para hindi tayo nagiging dependent tulad ng nangyayari ngayon sa pag-angkat ng bakuna galing sa labas. Kasi nung araw po, matapos ang giyera, meron ho tayong kapasidad at tayo pa ang nagbigay sa China ng mga bakuna. So nag-export tayo, nagbigay tayo ng bakuna sa kanila. Pero ngayon, kabaliktaran ang nangyari. Tayo ngayon ang umaasa sa kanila. Ano ho ba nangyari? What happened? So kadalasan yan ang tanong sa atin na ano nangyari sa inyo? So hindi ko masasagot yan dahil this is borne by the value that we have placed on the healthcare system. And if I may just make mention, no, matagal na ho yung panahon na nakalipas na nakita natin yung paglaganap ng mga specified and specific at dedicated healthcare facilities. So kailan ho ba tinayo yung heart center? Kailan ho ba tinayo yung kidney center? Tayo ho nauna sa Asia na nagbigay ng importansya sa pagpapalakas ng healthcare system. Pero matapos ng mga ginawang programa na yon, yung mga sumunod na administrasyon, palagay ko wala nang nangyari, nakalimutan na. So, kailangan natin pagtuunan ng bansin. At yun nga po yung sinasabi ni Secretary Galvez, that we need to focus on achieving a self-sufficiency in the healthcare system. So, we need to upgrade it. Kailangan talaga i-upgrade.
Very good. Rick, ano yung sinasabi mo? Ano yung experience mo sa nurses? Bago tayo magtungo kay Dr. Tan Cho Chong. Yes, please go ahead.
Yes, gusto ko lang mag-comment having come from the institutions on migration, no? Even prior to COVID, the World Health Organization and all the United Nations have recognized talaga na healthcare is going to be in demand all over the world, no? And sana ngayon ninilay-nilay tayo, no? Yung development planning natin dapat nakatuon sa healthcare, no? At bigyan to ng resources, yung health education i-promote, mag-build ng hospital sa grassroots na fully equipped, technologized, no, para meron silang platform for practices and be more competitive. At saka wag na sanang mangyari uli na magbabayad pa ang nurse para lang makapag-intern, no? Sana matapos na yung mga ganong istorya, no?
Okay. For the information of our friends in the audience, si Rick Casco used to be with International Organization for Migration. Kaya kabisado niya yung topic na yan. Doon kami nagkakilala sa mga events ng IOM. Pero Dr. Tan Cho Chong, you're a psychiatrist. Ganun din kay Dr. Chavez. How do we keep our marbles considering what's going on today. Dahil sabi nila, the situation today will definitely make you lose your marbles. Baka mabuang ka kung sa Tagalog. Dr. Tan Shoshong, please.
I think, thank you for inviting me. I think even though the pandemic is a pandemic of medical problem or specifically infectious disease, actually it's a pandemic of psychological problems. Okay, like even before the COVID, before contracting COVID, patients or persons, the people are already suffering from the fear, insomnia because of the worry about COVID. And the more, we don't have to talk about, the more psychological sufferings there will be when they get the disease per se. And also the after the COVID, as was mentioned by General Padilla kanina, na somebody committed suicide. So you can see that the psychological issue is very important. According to WHO, there's no health without mental health. So in that case now, the one who committed suicide, I think that case has to be referred to a psychiatrist or psychologist for treatment. Because before one commits suicide, there must be a lot of psychological concerns, like depression, feeling of hopelessness, and helplessness. That's why they think about committing suicide. So I think that is a situation that will require professional help.
Okay.
And so I'd like to say something about infodemic. Nowadays, what is aggravating this situation is the infodemic. With a lot of false and even fake news or even false information are being transmitted through this Facebook, etc., etc. So maybe we have to advise the public that try to be discreet, get those information from the proper authorities like DOH or WHO, or information, let's say, from these authoritative organizations like, let's say, like university hospitals like FEU, Metropolitan Hospital, UST, UP, things like this. Kasi now, one advice I would like to give to our citizens is that don't simply transmit any message without thinking about them. If we are not sure, then we better consult our friends, doctors. Kasi this is creating a lot of unnecessary worries.
Okay.
And for we as citizens, if we try to be discreet and try to avoid disseminating this wrong information, in a way, we are already acting as the frontliners.
Okay.
Now, I'd like to say something about the survivor. I'm happy that Mr. Casco has a very positive attitude. I think the survivor should have a proper frame of mind, positive frame of mind. They should not feel inferior, or they should not consider themselves as a second-class citizen because of this COVID. In fact, they can make use of this COVID to looking at it, treat it from a positive point of view, and then try to share their experience to the people, to the friends that these are the precautions they have to adapt. Avoid this one, or they do that they are proper precautions, safety precautions.
Okay.
So this would be my advice. So adopt a positive attitude.
Good. Yeah, thank you. Thank you. Pero Nick, Dr. Chavez,
Yes,
what
sir.
about the community? Paano tatratuhin ng komunidad ang isang gumaling na sa COVID? Katulad nga ng binabanggit natin kanina, parang ibang tingin eh. Baka yung taong yan, baka hindi na makabalik sa trabaho.
Earlier part ng pandemic, Melo, medyo ganun ang nangyayari. Pero ngayon, I can feel the confidence ng mga survivors. I can see, katulad ng kasama namin sa tennis club na nag-COVID, na mild to, parang ang lakas ng loob nila. Parang kumbaga sila, veterano sila. I'm survivor, veterano sila. And ganun din sana ang magiging outlook natin na getting them back to work. Kasi ano sila parang kumbaga sa quality wise, nakasurvive sila sa ganitong trauma or yung infections. Meaning, maganda kanilang quality ng kanilang pangatawan at pag-iisip. And but at this point, Melo, gusto ko lang susugan yung comment kanina na back in the 60s, we were the one producing the vaccine. And it's the Alabang vaccine serum. Na ngayon, unfortunately, PhilInvest na. PhilInvest ngayon doon. Andun ngayon andun yung hubad na babae na may snake na nakaganon siya na statue, no? Remember that one? Pero nabanggit din nila itong prioritization, no? I hope bigyan natin with this pandemic. And dapat kahit even before pandemic, bakit ka mo? Meron tayong first tayo sa Asian for Heart Center for Asia. Yeah. Meron tayong Kidney Center, meron tayong Lung Center, meron tayong Blood Center ngayon. Pero never pa na-establish ang Infection Center of the Philippines. What we have established is RITM, Research Institute of Tropical Medicine. When in fact, since time immemorial, ang top 5 nating cause of death is infection, pneumonia, bronchitis, lahat yun, mga diet, lahat yun infectious. Kung bago sana heart center or lung center, infection center of the Philippines sana muna, na kung saan ang mga research of mga vaccines, lahat ng mga ganong mga aspeto para sa pag-curb ng mga infectious disease, kagaya ng infant mortality natin, tetanus pa rin at saka mga pneumonia pa rin ang mga causes, mga infection pa rin. So nakakalungkot, sikat nga tayo sa heart center, sikat tayo sa kidney, sikat tayo. Pero yung infectious center, hindi pa rin. RITM pa rin, nakapraso pa rin, na nandito sa amin sa Muntinlupa, na pag konting pandemic lang, punong-puno na sila. Not even 100 bed capacity ang RITM. Because RITM is purely research. Pero hindi katulad ng pag sinabi natin katulad ng heart center, pagkalaki-laking building at saka lung center para mag-take care of this patient at the same time doing the research. So yun po yung susupo kay General kanina, at Dr. Gutierrez kanina na ang prioritization siguro would focus kung if there's anything na lesson to learn in this pandemic, it is the prioritization of serious establishment of infectious center of the Philippines, number 1. Number 2, yung sinasabi ninyong topic naman dito na yan sa community, again, as a rejoinder doon, walang substitute sa healthy living. Bakit kamo? Kahit anong bakuna natin, kahit anong lakas ng ating mga gamot dyan, pero yung mga hindi pa nagkasakit, at yung nagka-COVID naman, ito naman ang the other side, downside. Okay na ako, survivor na ako, pwede na ako mag-ano. Hindi po pwede. We cannot afford to lower our guards. We will continue to do healthy practice. Kasama ang healthy living is positive attitude of compassion, etc., forgiveness, etc. Sa ating mindful practice na tinatawag. No? So mindfulness, nandun pa rin yung tinatawag natin. Bottom line and basic pa rin ang healthy lifestyle. Be it hindi ka na-COVID, nag-COVID ka, or after the care, COVID. No? Yun po ang aking mga message doon. And then sa nurses, sir, ito, hihirit po ako. Kasi laman din akin ang post nung araw na yon nung sinasabing, nung inimplement na po, sinabi na po ng Supreme Court, 2017-18 ito. Nalulungkot nga ako, narinig ko kay President sa nurse, na ang sweldo pa rin, hirap pa rin ma-implement yung batas. May batas na po yun, ano? At natutuwa ako, sabi ni General Padilla, na ang nurses parang sundalo. Parang sundalo din po yan. Wala po yan silang panahon, wala po yan silang oras. Talagang nandun po lang siya sa frontliners. Ang difference lang ng sundalo, nabigyan agad na increase noong 2016-17. Natawa kami lang. Pero ang nurses, nagkaroon na ng batas noong 2002, nagkaroon ng Supreme Court ruling, ibinaba lang ang kanilang rango para mag-match. Could you imagine? Para mag-match doon sa tinatawag nating 32,000. Yung tinatawag ng salary grade 15, which is equivalent to 32,000 basic. Para mag-match doon, ibababa sila sa nurse 1. Nakakalungkot. So, thank you. Salamat.
Okay.
Magkakataon.
Doc Nick, you
Opo.
find it stupid?
Your words.
I just want to be clarified, no?
Hindi ko talaga maisip na pareho ang kanilang tapos hindi lang pareho, may batas pa, may Supreme Court pa. And then nung i-implement pa, gagawin pa, iikutan pa. That is circumvention.
Okay. Yeah, I can understand. So, pangdagdag siguro doon sa sinasabi niyong center para sa infections.
Yes,
What
sir.
we may need in the Philippines is a brain center, no? Medyo pag-aralan yung takbo ng utak, no?
Okay.
There must be something wrong. Okay.
Meron tayo, mental health center, sir. Meron na tayo.
Meron na. Okay. Anyway, I'd like to acknowledge, kasama na natin, the Honorable Cora Alma De Leon. Siya po'y dating chair ng Civil Service Commission. Timing yung pasok niya. At dati rin po siyang Social Welfare Secretary. So dalawang hats ang pwede nating ibigay sa kanya ngayon as a social worker. How should society treat COVID-19 survivors? And number two, yung disparity ng sahod ng mga nurses at ng iba pang civil servants. At pangatlo, anong impact ng COVID-19 sa government workers? Good morning, Madam Cora. Welcome to the discussions.
Thank you. As I said, I will be late pero I will not miss this. Pag si Melo ako niyan tumawag ng any kind of forum, talagang very substantive. At at ako, ang una kong gustong i-share ngayon is that ang effect ng COVID-19 is not just in one institution. Of course, it is the family, the community, and all of the other agencies. Narinig ko na ang sinabi ni Mr. Nicanor Chavez at nakita ko din na nandito ang Philippine Nurses Association at yung kasama na namin si Dr. Tancho Tan ay kasama namin sa World Association for Psychosocial Rehab. No? Siguro ang aking masasabi dito sa yung forum na tapatan, ako mismo ay naging COVID victim. No? Kaya ako sinasabing COVID victim because I was attending nag-radyo ako everyday, lumalabas ako, and finally I was hit in 2020. So alam ko yung damdamin ng nakakasakit, alam ko din yung requirements na para gumaling. Kaya tamang-tama yung sabi mong aftercare too. Dahil ano ba talaga ang effect after COVID, di ba? So whether you're a nurse, whether you're may mga karampatang katulad ng PNA, yung problema ng sweldo. In fact, akala ko nga dinagdagan yung mga frontliners na nurses. Maaaring hindi pwedeng dagdagan lahat na hindi naman involved kasi masyadong malaki ang kakailanganin. Pero at the same time, alam ko nung lumabas yung Nurses Act, meron ng requirement na increase sa sweldo ng basic pay. Narinig ko na rin yun. Pero siguro alamin natin ano ang kondisyon, lalo na kapag local government ang magsusweldo. Hindi talaga pwedeng pare-pareho. Depende sa kakayahan ng mga tao ng gobyerno sa kanilang lugar. I'll stop at this point para marinig ko kung ano yung mga issues na gusto nilang sabihin dahil ang aking pananaw as former DSWD Secretary and former Civil Service Chair will impact on my remarks.
Yeah.
Salamat, Melo.
Opo, maganda tong ating tapatang ito coming from all angles. Sabi ng isang dating board member ng member pa ng Professional Regulatory Commission, PRC, si Dr. Gloria Arcos, may export quality kaya ang nurse kaya hindi pinapansin ng gobyerno ang sundalo narito para ipagtanggol ang bansa. Baka ganun yung sistema. I don't know. Would you care to react, Madam Cora?
Well, ako naman ayoko ng attitude na e-export natin ng mga nurses. Kaya nag-mushroom ang mga nurses because opportunities abroad. But I remember Senator Blas Ople saying, yung overseas Filipinos natin, overseas workers natin, is really exportation of our discontent. Hindi sila happy dito. Hindi ba mas magandang alamin natin kung paano magiging maligaya ang mga nurses dito na para they can stay with their families. Pero there will be those people na they want more and therefore they will leave the country. Kailangan unawain natin yan. Pero yung pagbibigay ng sweldo, nasa nasa batas yan at nasa kakayahan ng pamahalaan.
Okay, very good. Napakaganda ng bagay na yon. All right, ngayon, ito yung sitwasyon natin. Halos 1 milyon na yung nakaligtas sa COVID. And I'm happy because they recovered. Can we look forward? You know, Dr. JB, siguro yung message mo sa ating mga kababayan para bantayan kung ano yung dapat bantayan, ano? Para alam nila na hindi sila long haul victims ng COVID-19.
Well, yung mabantayan nila, of course, if they have these symptoms, don't think na COVID kaagad sila. Okay? So always check if kasi the common flu usually resolves in 3 days. For COVID patients, matagal ang symptoms, even more than 3 days, even with antibiotics and all of those vitamin C, vitamin D, meron pa rin symptoms. So if you have symptoms, always consult your physician. And number 1. Then the physician will decide, will diagnose you properly. They will do all the necessary tests to rule out COVID infection. Now, if you have COVID naman, COVID kayo survivor, always expect na merong cough. No, don't be wag kayong malungkot dahil may ubo kayo. It's because nagre-recover pa kayo. Nagre-recover pa kayo sa COVID infection. Because those fibrosis fibrosis sa lungs may persist up to 3 months or habang buhay yung fibrosis na yon. And this fibrosis will cause yung cough and cough and cough. And especially sa elderly, advanced age, merong shortness of breath. Sabi, Doc, before ako nagka-COVID, wala akong shortness of breath, but after nagka-shortness of breath ako. Because of the fibrosis. And because, of course, matanda na eh. Kaya talaga may shortness of breath ka na. Hindi mo mawala yan. As you age, nag-age din ang lungs mo. Hindi mo mabata yan. No? Kaya, do the proper exercise. Proper diet, proper sleep. Ayan, no? Ganun gagawin natin. No? Long haul treatment, yun pa rin. Proper diet, proper sleep, no? Exercise regularly.
Okay. Doc JB, I have a question here from Jerome Morales of Reuters. Secretary Duque said on Friday that an India-like COVID surge is a big possibility if minimum health standards are not followed and if the pandemic response is not intensified. Do you agree with Secretary Duque's assessment? How far or close are we to battling an India-like surge?
It's a national concern. Oo eh. If you don't practice social distancing, ganun pa rin. Yung proper wearing of face mask, proper wearing of face shield, magkakaroon pa rin tayo ng surge. No? Andyan pa rin yung virus eh. And remember, yung coronavirus is a virus na meaning nag-replicate siya, nag-change siya ng strain. This is a virus that is what you call na hindi siya stable. Unstable virus yan. Unstable virus. It continuously mutate. Mutate yan. Mutate. Depends on the host kung mag-mutate yan. So, proper distancing, face mask, face shield to stop yung spread ng virus.
Mm-hmm. Okay. Thank you very much, Doc.
Yeah.
Madam Cora, bahagi ng ating mga frontline workers are the social workers. They are tasked to visit homes. Are they exposed to COVID as well? Yes, ma'am. Teka, paki-unmute lang po. Yan.
Alam mo, ang depende ang engagement ng social workers ng DSWD was really related to the ayuda. Remember, no? So medyo talagang engagement nila is sa communities because they have to follow the protocol. However, ang realization ko naman, medyo masyado na-emphasize ang ayuda, nakalimutan yung family problems, relationships, katulad ng pinupush namin ni Dr. Tancho na yung mental health, no? May mga kakulangan ang serbisyo. Kasi sa totoo lang, during my time when I was Secretary of DSWD, we were looking at the total family approach. Yung sino may kailangan ng trabaho, sino may kailangan ng training, pero yan ginagawa na ngayon ng ibang departamento. Ang TESDA has been doing this training, ang Department of Trade and Industry nagbibigay ng puhunan. So dapat mag-focus na lang ang DSWD sa relasyon sa mga pamilya at yung pangangailangan dahil nga dito sa pandemya or iba pang pangangailangan nila. So the short message ko lang dito ay ang mga social workers ngayon should just not be concerned sa ayuda, pagbibigay ng ayuda. Kasi yung kaperahan na yan, pwede nang magawa sa local government at even at the barangay level. Dapat ang skills ng social worker ay sa pagtulong para ma-improve ang buhay ng mga pamilya.
Very good. General Padilla, would you care to react to that? Because DSWD has been tasked to do something, play an important role in the dispense of the ayuda?
Well, ang nakita ko ngayon talagang we need to retrain our social workers dahil parang nangyari in the past, ang ginagawa talagang asawa, family welfare, family assistance. Okay. Oo, pero remember, may mga sa pamilya na merong mental illness, may mental retardation, may special needs. Dapat mag-concentrate din sila, hindi lang, to my mind, hindi lang ayuda, to know what are the needs in the family.
Good. General Padilla?
Yes, thank you very much, ma'am, for those very important comments. Yes, I do believe that there's a need to strengthen the family. Kasi I take from the premise that the family is the basic unit of society. And if the basic building block and unit of society is full of problems, paano natin mabibuild up yung buong society? So kailangan talaga pagtuunan ng pansin yung suliranin ng bawat pamilya. So in the same vein that ma'am was saying a while ago, yung social workers are the first line workers of government who must come to the family to find out these issues, yung mga hinanaing ng mga bawat pamilya. Ang una dapat nakakaalam niyan yung mga social workers natin. Sila dapat ang eyes and ears ng government na nakakaramdam, nakaka-empathize, nasasagap yung mga suliraning hinaharap ng bawat pamilya at mayroon na sila dapat mga recommendation na maibibigay para mapalakas yung mga pamilya natin. Kasi balik tayo dun sa premise na sinabi ko na the basic building block of society and the basic unit is the family. And so if we can strengthen and make the family much more resilient under these times, then we will have a better Philippines.
Yeah. Let me ask you, General Padilla, and the doctors aboard, no, sa ating discussions, merong vaccine hesitancy. And then came ivermectin offering some hope. Sabi nung ilan, baka raw maging substitute na ito sa bakuna, yung ivermectin. Coming from the National Task Force, General Padilla, what's the policy?
Well, totoo po yun, no? There's a danger of people relying on ivermectin. Sana naman po maintindihan ng mga kababayan natin, hindi po ito ang solusyon sa pandemya. Maaaring ngayon, ang feeling nyo, protektado kayo dahil iniinom nyo po yan. Pero hindi po yan ang tamang solusyon para wakasan natin ang pandemya. Ang tamang solusyon po ay ang pagbabakuna. So, yun po ang kinakatakot ng karamihan ng ating mga doktor na nagsasabi na maghunos dili tayo at mag-slow down tayo sa paniniwala natin na ito yung magiging cure-all sa sinasabi nating problema. Hindi po. So, ito ay panandalian lamang kung nais nyong gawin yan, pero dapat magpabakuna pa rin. Kaya nga po, kinakailangan i-ramp up itong information campaign. Hindi ho ako doktor, pero sa dami na ho na narinig ko na doktor, I clearly understand that whereof they're coming from. And I share the same thing, same sentiments with a lot of other assessments and analysis regarding the rise of ivermectin use. So hindi po natin dinidiscourage, makakatulong po sa inyo habang nag-aantay kayo ng bakuna. Pero pag dumating na ho ang panahon na nandyan na po ang bakuna, sana po lahat tayo magpabakuna dahil nandoon po nakasalalay ang pagbangon muli ng ating bansa at paggaling ng buong bayan.
Yeah. Okay. Dr. JB, your thoughts, please?
Tama po si General Padilla regarding sa topic na yan. Oo. Ang ivermectin talaga, it is not supported by the Philippine College of Physicians. Malaking topic yan. And I will not dwell onto that. The vaccines is there. Kailangan pong pag-vaccine tayo. Huwag tayong matakot magpa-vaccinate. Of course, ang vaccination is not the cure, but it will prevent us from getting into severe or critical COVID infection. Yun ang ating gusto natin iparating sa people na ang vaccine is to prevent the severe and critical case of COVID infection. Ivermectin is not the answer. And as of now, ongoing pa rin ang trials. Hindi pa namin ma-support ng Philippine College of Physicians and Philippine College of Chest Physicians ang stand nila regarding ivermectin. That's all. Thank you po.
Dr. Nick?
Melo?
Yes, Madam Cora.
Oo. I agree with the doctor there, no? Kasi sa totoo lang, maraming I would say nagba-viral sa sa texting yung medicine na yan. Which of course, ako I am a health advocate ako kaya hindi rin ako naniniwala. But there is a real problem. Merong mga tao, and I have friends, sabihin, Cora, I'm sorry, I will not be vaccinated. Parang they made already a decision. So how to convince them or how to unconvince them that not taking, she's also a senior citizen, not taking the vaccination even if available, refuses to. Meron bang magagawa doon? Maybe I can ask the doctors or even our NTF General Padilla. Ano kaya pwedeng? Kasi dapat siguro merong pronouncement yung sa mga ayaw magpabakuna, kung ano man ang dahilan, ay sasabihin mo ang goodness of the vaccine and therefore it will help them. Kasi parang very difficult to convince yung mga tao na ayaw. And it is not only the money because many of the local governments are supporting the vaccination.
Okay.
What can you say about this? Siguro si National Task Force. And another point is that baka magkaroon ng local task force ang combination para at the local level matulungan din ng National Task Force na meron ding tumitingin sa pangangailangan ng mga local communities. Yung
Thank you.
second part ko.
Okay. General, reaction please.
Thank you, ma'am. Bilang reaction po sa katanungan nyo, opo, meron na pong inilunsad na malawakan at malaganap na information campaign. At ito ay ang pangunahing ahensya ay ang DOH. Kasi sila po ang mga eksperto sa larangan na to. Pero ang hinikayat po natin, kasi ito po yung naging whole of nation na dahil pati pribadong sektor na nag-order ng mga bakuna ay hinaharap din yung ganyang klaseng suliranin. Kaya nagtutulungan po ang gobyerno at ang pampublikong mga ospital at saka mga pribadong sektor, mga private corporations, private hospitals, upang maklaro ito sa isipan ng mga tao. And I think the group that is coming up with the infomercials are coming up with more testimonials. Galing na po dapat sa tao, mga nabakunahan na tao, mga eksperto na makapagsasabi based on first-hand experience na ma-share yung kanilang experience. I completely agree that we need to ramp up the information campaign. And I think government and DOH is doing that on an increasing basis together with the participation of the local government. Pati local government po, lahat ng may kakayahan. Kung iba hong local government, very proactive na door-to-door pa. So sana ho magtagumpay ito. Pinapanalangin ko na madami pang makumbinsing mga kababayan natin. At tulad nga po ng nabanggit kanina ni Dr. Gutierrez, ay tama po yun, hindi po talaga gamot o cure sa sakit itong bakuna, pero may iwasan po natin yung pagtaas ng mga bilang ng mga namamatay kasi it will prevent people from getting into severe and critical care. And if science and data is something that you're looking for, we only have to look at the examples of Israel, UK, and the United States, where the graphs are all showing a downtrend, a continuing downtrend of serious cases ending up in the hospital and of fatality rates going down. Sa Israel po, almost zero na sila. So, hindi ho tayo naging kasing tagumpay ng Vietnam, na Taiwan, na sa simula pa lang ho, na-control na yung pagpasok ng sakit at nakipag-ugnayan at nakipagtulungan lahat, sama-sama sila sa paglaban sa COVID. Pero tayo, tinamaan tayo. Medyo naging complex yung emergency natin. Pero hindi ho ako naniniwala na walang kakayanan ng Pilipino para mawakasan ito at matapos natin. Kasi noong December, sabi natin magkakaroon ng surge. Pero hindi naman nagkaroon. Kasi nagtulungan tayo. Ginawa natin yung dapat nating gawin. Bawat mamamayang Pilipino. So kung ngayon, gagawin natin uli yun, magtatagumpay po tayo.
Very good. Thank you. Pahabol lang, bago natin bigyan ng daan si Rick Casco, based on what we've seen recently, no? 8,000 plus cases a day from 10,000 plus cases. Are we already no longer in danger of an India-like crisis? Any concrete measures the government should do from here on? From Jerome Morales of Reuters. Nakatutok ang mga kaibigan natin sa FOCAP.
Yes, Jerome. Melo, allow me to answer this from the perspective of the National Task Force. Well, again, as I made mention of the whole of society and the whole of nation approach, all the measures that we have put up are enough. And number one and chief among this is what our doctors and health experts are saying, that we need to be stricter about wearing of masks, face shields when doing the public transportation system, avoiding large crowds, tapos laging nagsasanitize at nag-uugas ng kamay. So pananatiling malinis ang pangangatawan at tulungan natin yung katawan natin na magkaroon ng maayos na immune system. So lahat po yan ay hindi pwedeng udyukin ng gobyerno o ng sino man sa bawat tao. Bawat tao dapat ang nagsisimula. So kung tayo po ay susunod at magko-comply sa mga minimum health standards ng itong paraan, ma-overcome natin ito. Hindi tayo mapupunta sa India-like circumstance. Kasi nakita naman po natin, bakit po nagkaganoon sa India? Hindi po ba may election sila, tapos may mga festival sila? At kung nakita nyo yung mga news report na authentic, na nagmula po sa India, medyo nakakalimutan po nila yung mask wearing, yung social distancing, at yung pagsasanitize. So, doon po naging simula ng exponential growth ng sakit. Kaya, kung tayo, ang halimbawa ng holiday season ng December ay ang titingnan, kaya natin, hindi tayo pupunta sa ganong klaseng sitwasyon kung tayo lamang ay magtutulungan.
Very good. Maganda yan. Maganda yung binabanggit ninyo. So at least there's some hope at the end of the tunnel. There's light at the end of the tunnel, provided the tunnel won't go any longer. Okay.
Melo, I want to make a comment.
Please.
Dito kay Dr. Padilla, no? Kasi we in our barangay, Donggalo in Parañaque, 2 weeks ago, I met with the barangay chairman at saka yung in charge niya sa health protocol. We had 33 patients, COVID infected. And today, I was told 20 na lang. So in other words, 13 had recovered and we're monitoring that. We're monitoring that per purok, to be able to find out what caused it, paano sila tinamaan, a little bit, parang very little effort in researching, and ano yung needs ng families. Kasi we are busy attending to the needs of the COVID patients, but what about the families? So we're now doing that, and we hope that ang kasama po natin dito, gusto kong balita dito, si Rod Lacsina, siyang ka-meeting namin, kaso tinamaan din ng COVID. Kaya hindi ko na-interview. Pero si Kapitana Marlene Burgos, senior sa akin yung information, from 33, they are down to 20. And we hope that as we move along, we will go to 0. Kasi syempre, ang dream naman natin to go to 0. Thank you, Melo.
Yeah, thank you. Jen Padilla, siguro sa susunod nating discussions, bigyan nyo kami ng pagkaka-sort out yung mga nagka-COVID ilan dito yung medyo nakakaaluan, ilan yung middle class, ilan yung pinakamahihirap. Dahilan sa isang tanong ni Dr. Gloria Arcos, paano yung walang pambili ng masks? Ano gagawin ng gobyerno? So we'd like to come up with facts and figures. Sino tinamaan? Ano yung recovery? Nagkatrabaho pa ba after? Dahilan sa bahagi ng tanong ng employer ay nagkasakit ka ba na nakakahawang sakit kamakailan? Pag sinabi mo tinamaan ka ng COVID, baka sabihin ako may freedom to hire, freedom to fire. So baka wala ka na rin trabaho. Doc, General Padilla, pwede?
Sige, Melo, no? I don't think merong granularity ng information o data yung ating database tungkol sa mga nagkasakit na ganun katulad ng binanggit mo. Pero sisikapin ko, tatanungin ko sa ating mga nag-re-record ng mga data na to kung kaya nilang ilabas yung granularity na yon. At kung meron man, ay i-share ko sa inyo po ito.
Maganda yan. Okay, we're pressed for time. Yes? Yes, please.
Yeah. Dr. Chavez here, Melo.
Okay,
Meron
yes.
kung limited ang time natin, gusto ko lang i-share itong panawagan. Number one, gusto kong natuto ako doon sa point of view ni General Padilla regarding vaccination tsaka yung pangampanya. Here in Muntinlupa, all 100% kami nangampanya sa pagbabakuna. Problema lang, nung congressional hearing, kinote si Dr. DOS Duque that vaccines, efficacy of vaccine is uncertain. Tapos sabi niya, walang namamatay dyan, walang nag-critical. Araw-araw meron naman. It will never help doon sa kampanya. Pag meron nabalita ang nurse, yung sa amin, health medtech namin dito sa Osmun, namatay after taking the vaccines and all these things. Itong mga ito na which beyond our limit naman to. Talagang hindi nakakatulong. Pero I will go out to campaign for vaccinations, no, sa lahat ng. Ngayon, this will lead us to a suggestion to Dr. General Padilla na ang tanong ko lang po, General, meron po bang psychologist o psychiatrist sa team ninyo? Why I ask this question? Because, Melo, ito po bold kong category ko sabihin. COVID is 20% infectious, medical, etc. 80% is psychological. Why? In all aspects, it entails about attitude and behavior. Wearing of mask, social distancing, culture, yung nag-ipon-ipon sa Israel at saka sa India. It's about the culture, it's about the psychological aspect. Convincing the people to go vaccination is all about mindset. It's all about convincing. Katulad po natin, nung nauna ang mayor just because they want to get modeling, binati ko sa mayor dahil nag-jump up sa queue. Hanggang naka 3 days naka-headline. Pero ang totoo niyan, Filipino psychology is role modeling, advertising. So nung nagbakuna lahat ang mga governors na ganun, tumaas din ang mga nagbakuna. So what I'm saying now is we should really approach our campaign, pati yung pagtanaw natin sa ivermectin, kung masyado bang legalistic ba yan. Because I cannot understand, Melo, why 5 hospitals given the permit, yung hindi binigyan ng permit as if hindi efficacious ang ivermectin pag walang license sa DOH, sa FDA. Bakit yung isa hindi binigyan?
Okay. I can understand.
Logic eh. Pag kayo pala kumuha sa bahay, parehong ivermectin. Ay, dahil hindi ka, hindi wala kang permit, hindi ka efficacious. I'm sorry. This is just my thoughts. Anyway, masarap talagang nasa isip din sa tao natin.
Melo, sagot ko lang. Short answer lang kay Dr. Chavez. Sir Doc Nick, yung NTF po ay mayroong mga psychologists at psychiatrists. At meron po, tulong-tulong po na
very good.
Meron po. Pati si Secretary Galvez ay meron din kinakausap na galing sa private sector. Pati ang simbahan kung minsan may consultation.
Diyan, hindi na ako kailangan mag-volunteer dyan, ha?
Kung kinakailangan pa ho, kailangan tawagin kayo. Bakit hindi?
Okay, all right.
Boss ko po si Dr. Galvez, boss
okay.
Sa Davao Regional Mental.
All right. Sige. Okay. Rick, anong message mo? We're about to wind up. What's your message being a survivor that you are? Go ahead.
First of all, natutuwa ako sa aking mga narinig, no? I agree with Dr. Nick na 80% cultural and attitude. So ang panawagan ko sa ating mga mamamayan, no, mag-sacrifice po tayo for cultural change, no? Kasi alam mo, Melo, nung 2 weeks lang umattend ako ng funeral, merong isang family na gusto iprosesyon pa yung patay,
Totoo yan.
pa ibuburol, no? At nagmamano-mano pa, no? Mano-mano, i-sacrifice po natin ito, no? Kasi hindi po tayo aahon. We should move on, no? At saka isa pa po, yung sa is part of our culture. I-follow nyo po yung mga rules ng malls, yung pedestrian traffic, yung mga arrows, yung mga mga footsteps, no? At saka yung mga restaurant, wag kayong mamilit na tabi-tabi kayong pamilya, no? Eating is the most risky activity. Even in my house, in the house of my friends, they eat separately or at intervals, no? So ito po, yung sinabi ni Dr. Nick, ito po yung nagpagaling po sa akin, no? Positive attitude, healthy lifestyle even before COVID and after COVID, no? At saka lastly, kapag po nung time ko, PhilHealth shouldered it all, no? Siguro kung ang health system natin will shoulder it all, gagaling tayo, no? Kapag ka milyon-milyon ang gagastusin, magnenervyos tayo, no?
Okay.
Yun lang po, no?
Thank you, thank you. Melbert, mula sa Philippine Nurses Association, your message please, your thoughts, looking forward, what will happen, please.
We would like sana na that the government would hear our nurses, ano po, that this opportunity will be, no, this scenario, situations that we are facing ay maging parang eye opener to everyone that nurses is part of the healthcare system and plays a vital role, no, at its core. And sana po ay, no, ma-lessen yung mga worries ng ating nurses with regards to compensation and benefits, para po hindi natin o maiwasan natin yung kinatatakutan natin that nurses would leave the bedside, you know, because they are not valued, they felt like hindi sila importante, ano po. So and to our nurses, sa nurses, sa ating Filipino nurses, ay patuloy lang ang serbisyo, kapit lang, ano po, and maraming salamat, ano po, na nananatili kayo sa hospital, no, despite the risk, no. At ganun din sa ating ibang health workers. Salamat po, Sir Melo.
Thank you. This won't be the last appearance. Marami pa tayong pag-uusapan. Dr. Tan Chiong, please, your message. I know you have a lot of students in our audience today. Your message, please.
Yeah, I like to say something that in this kind of pandemic crisis, I think even though the frontliners are the doctors like Dr. Jerry, Dr. Chavez, the police authorities, but I think as ordinary citizens, all of us should, in one way or indirectly, act as frontliners, and we can be frontliners by taking care of ourselves, because if we are okay, then we don't transmit the disease to other people, So educating and helping other people, in a way we are acting as frontliners, and helping people try to avoid helping people try to avoid mga wrong information, fake news,
Okay.
In a way, we also educating people. We are also acting as a kind of frontliners. So, thank you.
Thank you. Dr. Nick? Dr. Nick, mula sa Muntinlupa. Dr. Nick? Nawala si Dr. Nick. Nawala yung signal niya. Madam Cora,
Yes.
your message, please.
Ako yung quote na lang kay Albert Einstein, we may not be able to change the structure of the universe, but maybe by raising our voice, we can pursue the greatest of all causes, peace on earth and goodwill among men. I think your program justifies that. Tapatan sa Aristocrat, ni Melo Acuña is something that should be really praised dahil narinig natin ang maraming boses sa ating sosyedad. Thank you very much for the opportunity.
Maraming salamat po. Thank you. Dr. Nick, message?
Yeah.
Paki-unmute lang po. Yeah, okay.
Okay. Yeah, again, palaging paulit-ulit, maging makulit na siguro ako dito. Susugan ko yung kay boss Dr. Tanjong ko, ano namin yan, trainer namin yan. No? We can be all frontliners. At sabihin ko rin kay Ma'am De Leon na ang family is the center or the center of health. Na nakaugat talaga doon the unit, the basic unit, yung sinabi ni General Padilla kanina. Lahat sa abang aspeto kagaya ng problema sa mental health program, sinasabi natin sa family problem, even sa drug addiction, even sinasabi nilang sa control ng COVID. Pag matigas ang ulo ng isang kahit walang lumabas sa apat, pero yung isa lumabas na teenager, nakipaghuntahan, nakipagbidahan, pagbalik niya kanyan, gulo na lahat yung lima, damay na lahat. So I would say the whole thing is naka-anchor sa healthy lifestyle among families. Doon naka-emanate, naka-anchor lahat yun. No? Good health, good rest, sleep before 10, wake up before 6, regular exercise, good balanced diet, tamang sangkap, tamang oras at and then regular exercise, at saka avoidance of no to sad, smoking, alcohol, and drugs. Ito yung sa akin panawagan. Opo, yun ang basic. Salamat ulit sa mga ginagawa ng task force din, at they could also be very instrumental. Panawagan po natin approach sa behavior and attitude ng ating mga kababayan. Salamat po, Melo, again sa opportunity for opportunity for me to share with these ideas. No? Thank you. Salamat na.
Thank you for the time. Yes, Dr. JV, yung bang isang tao na lumabas ng ospital, nabakunahan, ligtas na ba siya sa COVID? Ano ba talaga? Mahabol na tanong, Dr. JV Gutierrez, please.
Yeah. You know, yung COVID, as I've said kanina, it is a very unstable virus. Hindi pa rin ligtas sa COVID. But this will prevent yung severe to critical illness. Now, the vaccines, no? If you're vaccinated. Maraming strains, mag-mutate pa rin ang virus. But we don't know kung gaano kalakas yung strain ng virus na yun. If you could more infectious, no? Or more fatal yung virus. Okay? So vaccination will prevent severe to critical. And Sir Melo, yung aking last message ko, education is still the cure to all of this. Education ng ating sambayanang Pilipino. Kung may education, lahat yan. Kasi kahapon lang taxi driver sabi sa akin, wala raw COVID. Gawa-gawa lang doon ng gobyerno. Nalaglag ako doon sa aking upuan, sabi ko, pumunta ka sa emergency room, punta ka sa ICU, nakita mo ba yung naka-intubate? So, education pa rin ang cure to all of this, education. Lahat, lalo na doon sa malilit, lalo sa class C and D. Hindi naniniwala pa rin na may COVID tayo hanggang ngayon. Thank you po, Sir Melo.
Yeah, Doc, isang tanong lang na standby. Kung delikado ang COVID, bakit yung mga taong grasa hindi nakamaskara?
Malakas ang immune system siguro nila.
Ayun. Okay. Okay, so yung hindi paliligo, baka makatulong, ano?
Sanay sa virus. Hindi pa rin yun. Hindi pa rin.
Virus. Yeah.
Melo, ang sagot doon, Melo, kahit sila hindi nag-social distancing, ang mga tao nag-distancing sa kanila.
Okay.
Pero biyaya po talaga, grace of the Lord yan. Biyaya.
Okay. Yeah, General Padilla, your message, please. As we wind up our discussions today, please go ahead.
Well, thank you. Sa unang, sa panahon na to, maraming salamat sa Melo sa mga organisan yung klaseng mga forum. Malaki po ang nagiging ambag nito sa tamang impormasyon na makarating sa ating mga kababayan. So, bilang pangwakas lang po na mentahe, tulad po ng aking nabanggit kanina, ang anumang problema, kung magsasarili-sarili tayo at magpupunahan tayo at hindi tayo magtutulungan, walang mangyayari. Hindi natin na ma-resolve yung problema ito. Kaya ang panawagan ko po ay pinakikita na po ng Diyos sa atin yung daan para makabangon. Kasi nitong mga nakaraang mga linggo, nakita natin, community pantry, naging strength ng bayanihan spirit, yung pagtutulungan, mga barangay, yung mga local government, nagiging mas maigting sa kanilang mga ginagawang hakbang. At ang lahat ng tao noong Pasko nakipagtulungan, hindi natin nakita yung surge. Ngayon, yung pagtutulungan na yan ay kailangan gawin uli natin. Kaya paigtingin po natin ng bayanihan spirit, yung ginagawa nating tulungan, yung may kaya gawin ang nararapat para makatulong sa mga nahihirapan. At obserba dun sa mga binibigay ng ating mga eksperto. Kasi tulad ng sabi ni Dr. JV, ang maraming tao ay hindi naiintindihan dahil maraming maling balita tulad ng sabi ni Dr. At sana nating ipaganap yung mga nakukuha natin na mali. Kasi ang mali, pagka pinalaganap pa natin, lalo pang magdudulot ng marami pang kamalian at maaaring maging sanhi ng pagkamatay ng mas nararami pa. So again, balik ako, bayanihan po talaga ang solusyon dito. Pinakikita na po ng Diyos yan. Pananalig sa Kanya at pagtitiwala at tulong-tulong. So let's be more compassionate. Let's be more diligent in fulfilling our duties and responsibilities as a citizen is of this country and as a matter of responsibility to others' health. Yun lang po. Maraming salamat.
Alam po ninyo mga kaibigan, I'd like to say thank you to Rick Casco for taking time out to share his experience. Yung aking anak na si JP was also with us today. Kaya lang he had to leave because of other meetings. And he intently listened to the counsel of our guests, no? And I'm happy that we got the best resource persons today. So I'd like to say thank you. And remember, there was somebody who said something like, sabi ay, he who has health has hope. And he who has hope has everything. Today is also World Press Freedom Day. We'd like to say thank you to everyone and to the members of the press for doing their job well. Thank you again to our guests, kay General Rusty Padilla, kay Madam Cora Alma de Leon, kay Ginoong Rick Casco, kay Nick Chavez, na ating madalas matawagan, kay Dr. Tan Cho Chiong, kay Mr. Melbert Reyes, at kay Dr. JV Gutierrez. Thank you very much for and on behalf of our friends from Tapatan sa Aristocrat, kay Sol Yuyi Tong ng Chinese Commercial News, kay mga kapatid natin sa media who sat with us today. Thank you. Have a nice day. God bless us all. Keep safe. Thank you again.